There are a lot of ways patient privacy can be put at risk, but if you're thinking about computer viruses, phishing schemes, or some black hat furiously typing away, you may be looking at patient privacy risk from the wrong perspective. Patient privacy is most at risk from the increasing number of data sharing and secondary use activities taking place today, both outside a company's firewalls and inside its carefully controlled network environment. DWise's de-identification software, Blur, is the leading clinical trial data anonymization software solution available today. The solution has been designed for clinical trial data by clinical trial experts and streamlines the entire data anonymization process, regardless of where that data is going to be shared. You may already be reducing the risk of patient re-identification by anonymizing or de-identifying data that's being shared outside your company's firewalls. Whether that data is being shared through a multi-sponsor data portal, sent directly to a researcher, or delivered in support of a journal publication. But are you protecting your patient data, even if it's used internally by your own employees? There are times when patient information is handled in a way that is against patient privacy regulations. At most biopharmaceutical companies, these types of violations occur every day. Different companies repurpose patient data in support of planning new trials, developing marketing strategies, or looking for potential new indications. Of course, this data is simply too valuable to gather dust on the shelf. However, this data comes directly from patients who have consented to a trial for a very specific reason. Even if that patient is no longer actively enrolled in a trial, their information is still under the safekeeping of the company. Whether that patient data is being formally organized into a clinical data repository or a more informal internal data sharing arrangement, the patient's data might be at risk of being used illegally or unethically unless it has been appropriately anonymized. Anonymization disassociates the data from the original patient, eliminating the risk of illegal use and enabling the data to be consumed for secondary use purposes. In the past, anonymizing patient data has been viewed as a low-volume, low-visibility task, relegated to biostatisticians and advanced SAS programmers. When it gets done at all, with the recognition that patient data must be anonymized for internal secondary use, now's the time to take a new look at your data anonymization strategies. For data being utilized internally for secondary use as well as data being shared externally, how can you protect your patient's privacy? Protect patient privacy. Get Blur today.